So we were discussing about the respiratory physiology. I think we were at this particular point. Let's go to the other basic points about the respiratory physiology. Now, what does this statement says? All parenchymal tissues with lung disorders, except emphysema. What is emphysema? It's a type of a COPD. Remember that. Emphysema is a part of a COPD. Has got poor compliance. Now, compliance has got so many questions that can be designed. Compliance has got. What is compliance? Compliance is the ability to expand. Is called as in compliance. So, because the lungs should have a good ability to expand, because lungs has to inhale air and to exhale air. So, poor compliance due to fibrosis. Now, of course, fibrosis leads to poor compliance because fibrous tissue cannot get stretched properly. For example, skin can be stretched, but the scar agar skin par hai, that cannot be stretched. And also the inflammation as well as infiltration as well as edema. So these are the disorders in which there is a poor compliance. So in these cases, if the compliance is poor, inspiration and expiration both are poor. This is what is called as CRPD, chronic restrictive lung diseases, in which what happens? The whole lung becomes small in size because of the fibrosis. And if you remember, this is called as an asbestosis and silicosis, sarcoidosis. All those are the examples of the CRPD, stands for chronic restrictive pulmonary disorders. Now, what are the common feature about chronic restrictive pulmonary disorders, which will also be coming up very important question in the medicine? What can be come up as CRPD? What are the common features in which the lungs has got fibrosis? The fibrosis leads to small lung capacities, also called as an ILD. ILD stands for interstitial lung disorders. In which the common feature is the fibrosis. We also have other restrictive lung disorders are called as an ARDS, pneumonias, pneumonitis are also the examples of other restrictive lung disorders. RLD stands for restrictive lung disorders. Now, lung disorders. Now, this is what we have learned in the presentation also, that in the obstructive lung disorders, if you remember, the bronchi are narrowed. And because of that, air can go in, but air cannot come out. Now, how can the air go in? How can the air go in? Air can, if the bronchi are narrowed, air should not be able to go in also, right? But going in has got no problem. What is the basis behind this? Because if you remember, COPD has got types like bronchiectasis and asthma and COPD. In this, inhalation has got no problem, if you remember, but exhalation has a problem. So what is the reason in which inhalation has a problem, exhalation has a problem, and inhalation has not? Understand what exactly happens in the normal physiology. When you are inhaling deeply, what will happen to the bronchi? Bronchi are constricted, dilated when you are inhaling.
Constricted.
No, when you inhale, what happens? When you inhale, the bronchi should take the air, right?
Yes.
This is what is the normal position of the bronchi. When you inhale, it becomes like this because the air should go in. This is what is normally happening. Let's say bronchi are narrowed because of the COPD. But normal physiologically, even if it is narrowed, during inhalation it will dilate. Right? So air which should go in properly. So going in air has got no problem. But when you exhale, bronchi come to the normal position of constricted, and again further it gets constricted because of exhalation. So because of that, in COPDs, because there are several questions designed in pathology, physiology, medicine, even pharmacology about this COPD. COPD is the most common disorder we have in the lungs. So because of that, this common sense need to be understood very well. So in COPD, inhalation has got no problem, whereas exhalation has got a problem. For example, in case of bronchiectasis, asthma, as well as COPD, as well as the other COPDs. In case of parenchymal disorders, restrictive lung disorders, there is a poor compliance. There is a poor compliance. So what is compliance means? Delta V to delta P. What is that? Of course, nobody's going to ask the mathematics out of it. Delta V to delta P. That means ratio of the volume change to the pressure change. Ratio of volume change to the pressure change. That means volume, kitna pressure change with producing what is a change in the volume. That is what is called as compliance. So compliance is ratio of volume change to
pressure change.
yes, and ratio of volume change to the pressure change. It is what is reduced by the surfactant. That is what is surface tension. Like let's say this is what is an alveolus. Now it is given the pressure to inhale or push the air. What is the volume change? Now volume change will be more if the ability of the alveoli to expand is more, right? Understand the common sense. When the volume change will be more if the ability to expand is more. Ability to expand is more if we have an adequate amount of, remember that surfactant in the lungs, alveoli. Remember, surfactant is produced by the type 2 cells. Type 2 cells. Now, surfactant reduces the surface tension. And surface tension is a thing that attracts the molecule towards each other. For example, let me give you a very simple example. This is what is the floor. If you put the drop of water on the floor, it looks like this, right? This is what is water drop. This water drop doesn't become flat because the molecules in the water has got attraction between them. So molecules are forming the globe like this. But if you put the soap water on the floor, then soap water spreads like this. Barabar? Soap water spread because soap water has got surfactant, which reduces the molecular attraction between the water molecules. So soap water reduces the surface tension. Similarly, surfactant reduces the surface tension in the alveoli, so that the alveoli can be expanding very easily. And if this surfactant is not there, that is what is a disorder called as the respiratory distress syndromes. That is what a surface tension is, an inward force acting maximum at the air fluid interaction. That means at the molecular attraction. Surface tension will try to collapse the alveoli. Abhi aage? Surface tension will try to collapse the alveoli, and this is what is reduced by the surfactant. So if surfactant is present, then alveoli will be able to expand easily. Then alveoli will be able to expand easily. That is what is in. If there is a surface tension, pull the fluid from the pulmonary capillaries to produce. Pulmonary edema is a condition in medicine in which there is a fluid collection around the alveoli. Pulmonary edema. So surface tension reduces the compliance. That is what is an easy way to explain. Compliance is ability to expand, and it is the surface tension that reduces the compliance. Of course, we also have learned that in our presentation that surfactant is from type 2 pneumocytes that reduces the surface tension. It is made up of simple squamous epithelium, and alveoli wall is made up of simple epithelium, so that it will be able to exchange the gases very effectively. Gases will be able to exchange very effectively because of the simple squamous epithelium. Is for the gas exchange. What is it? Single layer of the epithelium, and we have some cells called as type 2 cells. Some cells are called as the type 2 cells. Procedure कुछ important नहीं है. Spirometer. What is spirometer? Of course, to measure the lung volumes and capacities, we have the spirometer. Spirometer में what do they exactly do? The diagram कुछ दिया क्या इधर? नहीं दिया. Let me do the diagram. Now there is a patient who is here. Let's say this is what is the mouth of the patient. They give the tube, and the tube passes through the water, and that is attached the pointer. When the patient inhales air, the pointer will move up and down. That is, of course, nobody is going to ask the procedure of plotting the. This is what is called as spirometer. What is it called as? Spirometer is the mechanism by which the lung volumes and capacities can be measured. Lung volumes and capacities can be measured. What are the spirometer? And this is what then we talked about the tidal volume, right?
Yes.
The tidal volume. We also talked about the inspiratory reserve volume. What is that? Above the normal inspiration. Above the normal inspiration. It is about 3 to 3.5 liters maximum. So when you're doing exercise, what will happen? When you're doing exercise, you are going to use more and more inspiratory reserve volume because you want more air to go in, as logic. You want more air to go in. That is what is the norm. During inspiration, full expiration, what is that? अर्ध जावे क्या? This is what is something which is an.
मतलब brain रहती थी वो बराबर.
Okay, ठीक है. Now this is already we have discussed the lung volumes and capacities, right? Expiratory reserve volume plus tidal volume becomes an expiratory capacity. Expiratory reserve, what is expiratory reserve volume then? Expiratory reserve volume. That is over and above the tidal volume, how much you are able to exhale. Let's say this is what the tidal volume. So tidal expiration के बाद how much you can exhale. That is what is the expiratory reserve volume. That is what is expiratory reserve volume. Can you hear me? Hello? Hello?